This is a very precarious time for our nation, and in particular for state governments, which, as we all know, are responsible for the provision of so many vital services that Americans desire and expect. State legislatures are struggling to assess the impact of the economic shutdown caused by the coronavirus pandemic on state budgets. This afternoon, we will hear from two experts discussing possible scenarios about the pandemic might take, as well as economic impact of those scenarios could have on our country and our states. We will have time for questions after the presentations. As Kate said, please write your questions in the Q&A box. The tab for the Q&A can be found at the bottom of your screen. Our first presenter is Dr. Dylan George, who is Vice President in In-Q-Tel, where he provides strategic science and technical vision to strengthen capacity within the United States to counter biological threats, specifically those from infectious disease epidemics. Prior to joining In-Q-Tel, he served as a senior advisor for biological threat defense in the White House Office of Science and Technology Policy. While at the White House, Dylan provided technical expertise and interagency coordination, supporting the response to the Ebola outbreak in West Africa. Dylan was recently interviewed on 60 Minutes regarding the threats of infectious pandemics to our country. Dylan?
Thank you, everybody. Let me pull up my screen here real quickly. Are you able to see my slides?
We are not.
How about now? Let me try one more time.
I can pop them up for you.
That would be great. Sorry about that. So while we're waiting for the slides, hello everyone, my name is Dylan George. As was mentioned, I'm a Vice President in Be Next, which is the biodefense initiative from In-Q-Tel, which is focused on preparing for and mitigating biological threats that impact national security. Today, I hope to give you an overview of COVID-19 epidemiology for the United States. Okay. Let's see. And
are you seeing all the slides right now?
Yeah, I can see that. I can see them. We're on. So if we go to the key points, that'd be great. Next slide, please.
Okay. That pop? Nope. Okay. Hold on one second. I'm just gonna share a different screen here. Okay, now we're good.
Great. These are the three key points that I hope you walk away from this discussion today. Is like, first, COVID-19 will likely remain a disruptive force for weeks to months in the United States, but it will depend on your location and to some degree what happens in those locations. Second, we need to track public health vital signs so that we can understand and respond more effectively to the pandemic and mitigate that impact. And then last, we need a coordinated effort on data and analytics. Next slide, please. These are data from the New York Times. The x-axis is time since March 2020 to present. The y-axis is either daily new cases on the top or deaths on the bottom. The lines in each of these figures are the 7-day averages of what's going on either with cases or deaths. And what this is showing is that the US has reached a second plateau in daily cases at nearly 60,000 cases per day. Deaths as well are increasing. They are a lagging indicator, but we are seeing over 1,000 deaths per day. Fundamentally, this is concerning and scary. The main point I hope to drive home here is that our war against COVID likely will be long and difficult over the next weeks to months. Next slide, please. To help with some of the more particulars, I wanted to review a few key epidemiological concepts. The first one is, how do we measure pathogen spread? And this is the famed R0 number that has been discussed a lot in the press recently. The R0 is the average number of individuals that are infected by a case in an immunologically naive population, or sometimes it's referred to as R effective or RT, which is the same measurement but not in an immunological naive population, but the concept is the same. If you have an R number that is greater than 1, meaning more individuals, more than one individual is infected by each case, you're going to see the spread of the pathogen within the population or within a community. If you see it below 1, you'll see it decreasing. And there are three main components to R naught generally. And these components are the probability of contact between a susceptible individual and an infectious individual. That's an important concept. What is the probability of those two types of individuals coming together? Then the probability of transmission given that contact. And then lastly, the duration of infectiousness. All three of those kinds of main concepts come together to help you understand how it's going to spread in your community. The main point I want to make here, though, is that contact is critical for the virus to spread in a community. And for COVID-19, sharing breaths as a way of describing it, how close we are, that we might actually share breaths with one another, is very, very important. Infection through surfaces is a critical component as well, but largely it's the breaths. Next slide. This next idea is herd immunity. What this is a concept for a threshold within a population that needs to be immune, such that the pathogen cannot sustain spread and will sputter out. In short, it is an immunity shield for a population. Again, if you have a low probability of an infectious individual coming in contact with a susceptible individual, then you can protect people. And you can see on the right hand here, there's an image that I pulled off of Wikipedia to try to describe this, where you have blue individuals that are not immunized, but they are healthy. And then you have red individuals that are plopped into that population. And if those red individuals are able to bump into the blue individuals, you're going to have all of the individuals turn red that are going to become sick. Now, if you have the same population on the bottom row of that figure, if you have a handful of people that are immunized, those yellow individuals, you plop in a red individual into that same sort of population, you're going to get much less spread. And so this is a way to help critical, vulnerable groups like those that are immunocompromised for whatever reason, be able to protect themselves. And so once we get to that threshold, we can actually have much more protection across the population. Next slide. So these two concepts are very useful in helping us think about what potentially could happen going forward. Oh my gosh, this was terrible. What happened? It went on its side. Well, this is actually, you're going to have to move your head on the side to see what happened. I'm not sure exactly what happened here, but really what it is it's showing our colleagues at the Institute for Disease Modeling in Washington, D.C., or in the state of Washington, actually have been able to actually look at R0 or R through time. And what I'll try to describe on this figure, if you get a kink in your neck as you're looking at it, is that they've been able to actually make estimates of R through time since the beginning in March to present. And what they've seen is that there was estimates in March of about 3 that came crashing down with the lockdowns in the state of Washington to bouncing around 1. And then now, as they've been opening up different areas, they're starting to see it increase above 1 again. Now, there's a couple things to take away from this. If you could see it, or if you don't get a crook in your neck from looking at it in such a funny way, the first one is you should take away from this is that lockdowns worked and they brought down the spread of the virus. The second thing is you can see that there's variation in different parts of the state. If you could see that figure, the purple line is for the west counties and the red line is for the eastern counties. And so there's differences in different places on how it's spreading. The third bit is that all lockdown efforts didn't bring the virus completely under control. We need more effort because we're seeing it bounce around 1, meaning that it could actually spread and take off as we release going forward. And the last thing is that we need to increase in public health capacity to help fight this COVID-19. Next slide, and hopefully that one is okay. Good, excellent. We are all asking ourselves, what will happen next? To answer this question, it depends largely on what we do individually and collectively. Will we physically distance, mask up, wash hands, respond to contact tracers, and will we be able to make it so that people are protected at work when they go back? The degree to which we use these public health interventions will be the degree to which we can have a better sense of what will happen next. Next slide. For medical procedures, we all know about vital signs, things like respiration, blood pressure, heart rate. These are all critical signs to help the doctors understand how well you're doing as an individual. Similarly, for public health, there are vital signs for outbreaks too. These are signals that help public health individuals understand how the population is doing with the outbreak. And I bucket these into three broad categories. And the first category is epidemiology. How is the virus spreading in the community? We've talked about some of this already. The second is is hospital capacity. Can the healthcare system handle the cases? Will our healthcare workers be protected as they actually interface with people that are tragically sick from the pathogen? And then the third is public health capacity. Can we chase down the virus in our communities using public health interventions? Each of these categories has its own measures to help local communities understand their risk from the pandemic. For epidemiology, it's the cases and death counts that with particular focus on vulnerable populations, like those in congregate settings like nursing homes, that are really critical to understand. And we already saw some of the national data that I showed at the very top of the presentation. For hospital capacity, it's bed usage, supply, and staff availability. Those are very critical kinds of components to know that our healthcare system will not be overwhelmed and that our healthcare providers will be safe when they're trying to protect us. In short, protecting the protectors. And then this last bit are for the public health capacity, it's testing, tracing, and isolation capabilities. Do we have those capabilities in the localities such that they can go actually and root out the virus from our neighborhoods and help us be safe? Incidentally, my colleagues at Resolve to Save Lives and a couple other groups have put together a description of these public health vital signs, and you can see the link at the bottom for more details. Next slide, please. Now, this slide is very busy, and I don't expect you to take it all in. It's a bit of an eye candy chart. It is an example of how you can use these vital signs to understand risk in a particular state. This is just a snapshot of the vital signs from a few randomly selected places that have been put together, again, from my colleagues from Resolve to Save Lives and others, and those that have at this organization called COVID Exit Strategy. And you can see the overall assessments in the map in the lower right-hand corner, where green is good, yellow is okay, and red is struggling, and dark red is big flashing light. The main point with this slide is that you can use the vital signs to understand risk in your community. Next slide, please. And to quote Tom Frieden, the former CDC director, he said, everyone should easily be able to know the risk of COVID in their community and how well their community is doing to bring that risk down so they can keep themselves and their families safe. These are the vital signs for public health to help us do that. Next slide, please. Now, what countries were prepared? A report by the Nuclear Threat Initiative, the Center for Health Security, and the Economist Intelligence Unit put together something called the Global Health Security Index. And the main point of this particular report is that they warned us well before COVID hit that no country is prepared and that we need to take this seriously in going forward. Next slide. And this slide is what we're experiencing right now in the United States. You can see from this visualization from Our World in Data, they have compared countries using days since first confirmed cases reached 30 per day on the x-axis, and log number of cases on the y-axis. And it's not really important to know the specific details, but it's a way of comparing countries very quickly in one visualization in a quick snapshot. That's what they're attempting to do with this. In short, the United States is leading the world in daily cases and deaths. This is a hard figure for me right here, and it gets me right in the gut. Next slide, please. So it leads me to the question of what improvements do we need to do to fight COVID going forward? There's many things, and I've listed a handful of them here using these images, and these are many of them, but not all of them. But I do want to take a moment to highlight the need for better data. Next slide. And next slide. Yeah. Data is a very powerful weapon against this virus. We need to be able to find cases before they become clusters, clusters before they become outbreaks, outbreaks before they become explosive epidemics that threaten our healthcare workers and our healthcare system and move things going forward. But we are using old technology. We are using fax machines to transfer data among the healthcare facilities and the public health. Perhaps some of you in the audience don't even know what a fax machine is or have not even used a fax machine in many years. But that's how we're doing it right now. We're fighting COVID-19 with fax machines. We have underfunded public health data tech for a long time, but fortunately, Congress is attempting to address this shortfall, and they've put in some resources into the CARES Act that has passed previously, and are considering efforts in the HEROES Act and some of the other Republican recommendations that are moving forward to address this shortfall as well. Next slide, please. Also, we need better data analytics for outbreaks. So for natural disasters like hurricanes, we have forecasts and warning systems that help us know the risks to ourselves, our families, and our communities that help save lives and livelihood. My colleague, Caitlin Rivers and I have argued for a much improved means of warning and forecast for outbreaks, for pandemics, to save lives and livelihoods in a similar fashion. You can see our article in the Foreign Affairs that we published just a couple weeks ago if you're interested in learning more about that in particular. Next slide, please. And last, I did want to spend a moment to compare natural disasters and pandemics. The closest analog many of us have to the current situation is a natural disaster like a hurricane or a tornado. These are tragic and devastating events without a doubt, but they are acute and discrete events that require a surge of effort and then recovery. And people come together to help out in an impressive way to try to help one another in our communities. And it's always inspirational to see how people come together. In a pandemic, as we're sadly experiencing right now, events unfold slowly over time. They put significant pressure on our social, economic, and political systems. And importantly, as we are experiencing right now, getting past the peak of the pandemic does not mean it's over. Again, it depends on what we do today individually and collectively, what will dictate what will happen in the future. Next slide. And here are my key points once again, is that likely this will be with us for a while. We need to have better data so that we can track those vital signs of how we're going forward so that we can make sure that we're doing the best we can. Next slide, please. And lastly, if I can be helpful in the future, I'll stop here, but if I can be helpful in the future, here's my contact information. Please reach out. I would be love to chat with you and see if I can be helpful in any capacity. Thank you very much.
Thank you, Dylan. Our next presenter is Dan White, who is the Director of Governmental Consulting and Public Finance Research at Moody's Analytics. In this role, he oversees economic research with an emphasis on fiscal policy and municipal market impacts. Dan has appeared in a number of print, radio, and television outlets, ranging from Bloomberg Television to the Wall Street Journal. He also works closely with many governments and policymakers in an advisory role, and it is an adjunct professor of economics at Villanova University. Prior to joining Moody's Analytics, Dan served as a financial economist for the state of New Mexico. Dan?
Thanks very much, guys. I appreciate you having me here today. It's my first time before this kind of a group. I'm usually in front of a lot of state and local government policymakers, but first time in front of this group, so I thank you for having me. I know that there are several of you who have probably seen me speak in the past, but as Neil mentioned, I used to work in the public sector, and now I work in the private sector. And one thing that I have found that is universal across both sides is to always keep the lawyers happy. So I actually have to have a little bit of a disclaimer before I talk to make sure the Moody's lawyers are happy, folks. So I work for Moody's Analytics, which is an entirely separate company from Moody's Investor Service. So please don't let anything I say today be misconstrued as having any bearing whatsoever on past, current, or future ratings actions. If that sounds like it was written by a lawyer, it's because it was, but it keeps me out of trouble, and so I always have to drop that in at the beginning of the presentation. So there's a nice graphic so that the lawyers will see that I did that as well. So if I didn't come here to talk to you about ratings, what did I come here to talk to you about? Well, I kind of came to talk to you about kind of the other side of all of the things we just heard about in terms of the epidemiological forecast. So what that means in terms of the economics that come around this, what the economic outlook is, and more importantly for you all as leaders in your respective state legislatures, kind of what that means for your budgets and the decision-making process that you're going to go through over the next couple of years. I've been really struggling for some time now to come up with a good analogy for what this is like, because as it was mentioned earlier, we work very closely with a lot of you in the state legislatures and with governors and policymakers around the country. And we're hearing a lot of the same things from everybody. We're kind of coming up with different ways to look at it, but the one really good analogy that I've come up with this so far is from one of our clients the other day told me, when we're working on this budget, it's like trying to nail Jell-O to the wall, right? So we've got things that seem to be changing under our feet constantly. Every time we think we have a plan that's in place and we know how this is going to play out, things change, whether it's some of the epidemiological assumptions that we just heard about, or whether it's changes that the governor is making to business restrictions or travel restrictions, changes from the federal level, whether or not we're going to get federal aid, whether we will get federal aid or not. There's a lot of things that seem to be in constant flux, and so trying to build a budget around that is a very challenging experience. However, what we are noticing in terms of the states that are having the most success kind of putting this into action are states who are doing a lot of what we've been advocating and working with them to do in the past in terms of stress testing and using very different economic scenarios to go about their budget. So what I want to talk to you a little bit about today is stress testing, using different economic scenarios, some of the best practices that we're seeing in terms of folks who are really having success around budgeting around COVID-19. And also, I want to leave you with some very important questions that you can and should be asking the folks in your state, so your advisors, the economists that are coming to you with revenue forecasts, making sure that you're on top of that and making sure you're making all the right considerations. Okay? So the very first thing, and by the way, I got this clip art from Google. If you Google, nailing Jell-O to a wall, there's some very interesting pictures that come up. Actually, there are all kinds of science websites that talk about, the experiment of nailing Jell-O to a wall, down to the exact, instructions for how to do so. So if you ever, we're all in lockdown. So if you're home one day and you've got an afternoon to kill, Google how to nail Jell-O to a wall, because there's plenty of folks out there who would like to teach you. But the one thing that was constant across all of those different websites is very constant also with the budget process. And they said that the most successful way to nail Jell-O to a wall is to use more than one nail. And that has a really great, segue to the way that we budget for difficult times like this, when the future is most uncertain. Preparing for a range of potential budget outcomes can really make the decision-making process a lot more straightforward because we've got contingencies in place. It allows us to be proactive. And what we've found, all throughout history is that policymakers and their staffs who are the most proactive in terms of dealing with crises like this, they're the ones who generally come out to the other side in a much better situation. So the easiest way to be proactive about this when you're making budget plans is to go beyond your baseline. So don't just consider one baseline and then build all of your plans around that. You should be looking at several different alternative scenarios, both from an economic perspective and an epidemiological perspective. And if you're doing it right, those two should dovetail together pretty well to give you a couple different options in terms of what the kind of overall distribution of outcomes can be. Now, when we do this, we actually do a lot of stress testing for state governments ourselves. And one thing that we've done at Moody's Analytics for the last 7 or 8 years is we've done stress testing in-house of state budgets to see how states will fare when we go through a recession, not necessarily contemplating the kind of recession that we're seeing right now. So since about, again, 2013, 2014, we've been doing this exercise every year. And what we have done very recently is we've actually adopted that methodology to look at several different outcomes for state budgets, see how much money states are really going to need over the next few years, and kind of get a sense of what budgets could potentially look like over the next 2 years as you all go through and try and make amends of this total mess that has become your budget plans. We're still, many states are still trying to find ways to square the circle for fiscal 2020. And there is fiscal 2021, which most of you have already passed budgets, and you're going to have to go back and fix those budgets. And then on top of all that, you walk right into the next buzzsaw of trying to put together a budget for fiscal 2022 on top of all that can make things very interesting. So what we would like to do is talk a little bit about that process. When we do our stress tests, what we do is we first start with the economic scenarios. So the two economic scenarios that we are working with right now in our most recent stress tests are a baseline and an S3 scenario. Now, if those mnemonics don't quite sound familiar to you, those are what we use internally at Moody's to differentiate amongst our forecasts, because we actually do 9 off-the-shelf forecasts every month. And that allows our clients the ability to go through and use different assumptions, use different types of views of the world when they're making either their budgets forecasts or they're doing revenue forecasts if they're a bank or a private business. The two that we're looking at right now, our baseline, is what we would call a moderate stress scenario. And I only say moderate because it's moderate relative to all of the other scenarios that we've looked at. So we're absolutely looking at a severe amount of stress, more stress in state budgets than we've probably ever seen, certainly in my lifetime. And most of the folks I know who have been working in state budgets for a long time, we've never seen this kind of uncertainty and this kind of stress kind of hitting all at once. The baseline in our most recent stress testing exercise assumes that the worst of the pandemic is either here or it's very close to here. So once we get into the fall, as we heard earlier, we should start to see, it's going to be a very long process, but hopefully we're plateauing and we've kind of hit the next crest, not just in terms of the amount of outbreaks, but also in terms of the business restrictions, the stay-at-home orders, the shutdowns that we're kind of seeing. Those two kind of go hand in hand. So we've got, the restrictions and the shutdown orders are going to follow the epidemiological results. And then consumer behavior additionally is going to follow those as well. So even if we were to open up everything tomorrow, I think you'd be hard pressed to find a lot of people who are willing to go out and engage in the same kind of activities that they were willing to do, just a couple of months ago. So that's our baseline forecast, which again kind of assumes that most of the worst of this is over from a shutdown perspective. What that looks like in practice is that the end of this year, the jobless rate over the average of the fourth quarter will be about 9.5%. And at that point, GDP will still be down about 7% from the end of 2019. That's significant. That is much more significant than we saw during the Great Recession, and orders of magnitude more significant than anything that we had seen really in the 40 or 50 years running up to that point. In practice, that also means that the job market probably doesn't fully recover until late 2023, which from a stress testing perspective really matters because the number of unemployed persons in the economy is a major input into our stress testing calculations for reasons that we'll talk about in just a minute. Okay. The second stress test scenario that we've looked at as part of this exercise is what we would call our severe stress scenario. This is what, under normal circumstances, we would call our normal recession, if there was anything remotely like a normal recession. What this means is we think this is the most likely severe stress scenario. We have other scenarios we look at that are even more stressful than this, but this is kind of what we would expect, the most likely worst case scenario to be. Now, in this kind of a scenario, again, similar to some of the epidemiological data that we saw in the first presentation, we see a second round of outbreaks, a second spike in infections, and that leads to a double-dip recession by the end of this year. So in a response to that spike in outbreaks, we actually see, more governors, reinstitute stay-at-home orders, more business restrictions, more travel restrictions go into place, and that really hurts the economy. As a result, you also probably see, again, consumers pull back even more than they already have, especially if we don't get another stimulus bill out of Congress, hopefully in the next couple of weeks. This is a very likely scenario in that kind of an instance. That leads to a second recession in the fourth quarter of this year, which means that the jobless rate at the end of 2020 will be more like 11.5% than the 9.5% we have in the baseline model. And that means that GDP will still be more than 10% lower than it was at the end of 2019. For GDP to be that low for that long is, again, something we'd have to go all the way back to the Great Recession to really put some context around. The really depressing part of that scenario, if there can be a more depressing part of it, is that the job market in that instance doesn't fully recover until we get to early 2026. So that's almost a full 7 years in terms of trying to regain all the jobs that we lost during the recession. For context, it took us about 5 years for the job market to regain all the jobs that it lost after the Great Recession. So this is a full 1.5 to 2 years longer than that. And the fiscal implications of that are obviously very significant. Now, the upside to this is that the fiscal situations are going to be terrible. I don't know what else to tell you that, but states are going to get through it because that's what states do. States always get through it because they have to make their budgets balance, as you all well know. Now, that might involve making some very, very difficult fiscal decisions, especially if we don't get more assistance from the federal government. But state budgets will survive. The problem is if states do survive in that manner, it's going to have tremendous amplifying effect on the business cycle, and it's going to make the economy even worse than it already would have been. And to give you some context around what that means, I've run these two scenarios through our state revenue and our state Medicaid models to give you a look at what the full kind of fiscal shock to states could be as a result of this. So under our baseline scenario, the total combined fiscal shock, and I'll talk about that in a minute, is about $312 billion over the next the next two fiscal years. But if we include the shock that was in fiscal 2020, which just ended for most of you. Now, the way that we do this is we compare our revenue models. We have a different revenue model or revenue equation for all 50 states, similar to what your economists have in your states. And we use our baseline forecast, which actually, an overwhelming majority of you, there is somebody in your state who is using our forecast to do this kind of an exercise. They're running this through their Medicaid models and their revenue models, and they're comparing back to a baseline. Now, in our revenue models here, what we're comparing to is basically a revenue constant baseline. So just what would, the 2019 budget, if we just grew it out by inflation every year for the next 3 years, how much revenue are we going to need to fill the hole between what we'll have and what that would have been? And so for states under our baseline scenario, that's about $230 billion, again, over 3 years, which is quite significant. It's more than anything that we usually stress test against, and it's certainly more than we would have seen during the Great Recession. In terms of Medicaid, Medicaid is another important piece of the puzzle because when we look back to the Great Recession in particular, but also other recessions, we see that the shock that states have is not just from a revenue perspective. So most people think when we're looking at this that revenues are falling because the economy is falling. But another thing that we see is basically mandatory spending items go up as well, and they go up very quickly. So oftentimes the very first thing that you'll see, the very first sign that there's a recession in your budget will be because you have a sharp increase in your Medicaid spending, not necessarily a decline in your revenues. When Medicaid spending goes up, because it is a mandatory spending item, it's the same as revenue going down because every additional dollar that we're spending on Medicaid is a dollar that can't be spent elsewhere in the budget. So it creates fiscal shock and creates, very difficult decisions for you all as policymakers. The one thing that I will point out that is very different about these results versus other results, in addition to the magnitude of the results, is the length of time that they encompass. So normally when we do our stress tests and we look at previous recessions, the material impacts from a recession last for about 2 fiscal years for a state budget. We can see that even under the baseline here, which is again a moderate stress scenario in the grand scheme of things, this lasts at least 3 fiscal years, if not further. So the breadth of this area of fiscal shock is going to be much larger than we've seen in the past. If we are to combine this with local governments as well, this number goes up also. So using some back of the envelope math based on previous recessions, we can estimate that this $312 billion shortfall for states, when combined with local governments, balloons up to almost $500 billion. And that's one of the reasons why when you see a lot of folks, ourselves included, talking to people in Washington, we've been advocating for at least $500 billion in aid, flexible aid coming from the federal government to states and local governments to kind of smooth this out. Now, to answer the question that you're all probably thinking to yourself is, what does this mean for my state, right? The differentiation from one state to another is really, really significant. So if we look at this in a map of the US, we can see that the implications vary significantly based on a number of different items. Now, when we run our normal stress tests for states, what we normally see is a lot of differentiation from one state to another based on the state's tax base. So are they a state like North Dakota or Oklahoma that relies a tremendous amount on energy taxes? They're going to see a lot of volatility in their tax code anytime we go into a recession, just because they rely on a very volatile industry. Are they a state like New York or California that has a very progressive personal income tax? That also usually generates a tremendous amount of volatility when we look at around business cycles and changes in the outlook. What we see more of with this particular stress test is we see states who, again, have those very volatile tax structures like we just talked about, but also those states with with exceptionally high exposure rates to the coronavirus or COVID-19, and those states that have really implemented heavy business shutdowns. As was said earlier, the states who have done the really hard shutdowns have done a good job of preventing a resurgence in the virus. But what that has had an effect of is it's really had a disastrous effect on most of their economies. And we're seeing that when we look at their revenue projections in particular. The other thing that we see here, and I should mention that this is the cumulative 3-year fiscal shock for a state as a percentage of its gross state product. So as a share of the overall economy. The other differentiating factor here are folks who rely heavily on the public sector, rely heavily on tourism, and rely heavily on energy, which is why you see, again, states like Hawaii and Alaska, really New Jersey, seeing very large increases in what they're trying to do in terms of the fiscal shock. So the numbers here on the bottom right-hand side of your screen, that shows a percentage of the gross state product. So you can see that in a case like Louisiana, for example, it's much more than 2% of the overall economy. So if Louisiana were to go into their budget and they were not to get any more aid from the federal government, and they had to get everything done by either raising taxes or cutting spending, that takes 2% of the Louisiana economy right off the board, right offline, immediately, which is going to have potentially disastrous effects when we talk about the recovery and what comes after we hopefully see this peak in coronavirus cases. Now, that's the moderate stress scenario. So I hope I haven't bummed you all too much out yet, because we still have the more severe scenario to talk about. And then I want to talk to you a little bit about, the questions you can be asking and things to be sure that you're taking a look at when we do this. Oops. So aggregate fiscal shock, again, the same kind of math that we were doing before. However, the magnitude of these numbers is obviously much larger. So we're looking at about a $500 billion impact of the severe scenario. That double dip recession all happening in one calendar year really wreaks havoc, especially on the revenue numbers, but also has a big impact on the Medicaid spending as well. The increase in the number of unemployed persons and the fact that they're unemployed for potentially a very long time in this scenario creates, some significant stress on the Medicaid programs. If we were to include local governments in this as well, the number is actually as high as $750 billion when we look at this over time. on a state-by-state basis. The same differentiating factors from one state to another. However, I kept the scale of this the same just so you could see the difference in the moderate versus the severe scenario. So many states would see such a large fiscal shock here that it would really wreak, havoc on their budgets if they had to accomplish all of these fiscal straightening house by just cutting spending and raising taxes. If we don't get additional funds from the federal government to help alleviate some of this, then the potential economic fallout is, it's very sobering chart to look at. I'll just leave it at that. Okay. So now that I've thoroughly bummed you all out with the two bad scenarios, I unfortunately don't have a better case scenario than those two. That's really what we're seeing when we look at our forecast, when we look at some of the epidemiological assumptions that were laid out there before us. So this all nets, as you, I'm sure have already figured out, to very difficult fiscal decisions coming down the pike for you guys in the next 2 years. So as a part of that, I wanted to talk about some keys that we are seeing in terms of best practices and things that can make those decisions certainly not easy, but maybe easier than they otherwise would have been. Okay, so the first key takeaway that I want to talk about is using more than one nail, right? So if we're nailing Jello at a wall, we want to use more than one nail when we put this all together. As part of the planning process, you really should be doing this already, and I would hope that many of you are. If you go back and talk to your economists and folks in your states, I'm hoping that you're already seeing this taking place. Having a distribution of potential outcomes can really make the policymaking process a little bit easier when you eventually do have to make those very difficult decisions, okay? The second point I want to make here, and this kind of goes back to the first a little bit too, is to make sure that you understand the key assumptions around what those scenarios are, okay? So when you go back to your state and the economists bring forth, their revenue forecasts, whether they're based on our forecasts or, some other company's forecasts, make sure that you fully understand the assumptions that go behind them. Okay, and I say that because that's an issue that we learned the hard way at Moody's. When we build out our alternative scenarios, every one of them now comes with a narrative that talks explicitly about what the world looks like under that scenario, what causes that type of scenario to happen, so that policymakers and business leaders can make decisions specifically around what they're most comfortable with in terms of their risk tolerance, et cetera. The one key pitfall that I see people fall into quite often when they look at these identifying assumptions is they look at a baseline, and then they look at an upside scenario and a downside scenario. And those upside and downside scenarios don't have any rhyme or reason to why they are what they are, right? They're, this is 10% better than we thought it was going to be, and this is 10% worse than we thought it was going to be. And that can really lull you into a false sense of security where you feel that you're being cautious, but you realize that you're not being nearly cautious enough for the actual risks and assumptions that could have happened. So I would implore you to, regardless of who your economists are and what forecasts you're using, to make sure that you really understand those assumptions that are driving each scenario, and understand which specific drivers within those forecasts are driving your budget outcomes. So if you are a state that relies a lot on tourism, you're definitely going to want to know what's happening with disposable personal income. If you're a state with a very progressive personal income tax, you're going to want to understand the implications around the financial markets and very high income levels. If you have a very large Medicaid program, you're going to want to understand what's driving the number of unemployed persons, the forecast for that, because that really does a lot for understanding the full scope of outcomes and helps your decision-making process as policymakers. Now, the last piece of this, before we get going, because I know there's a lot of questions that folks want to ask, is to make sure that you're considering the whole picture, okay? So this goes to that discussion earlier about revenues and spending, okay? So when we look at recessions, most people want to know, what does this do to my revenues? That's what they think of. But if you go back to 2008, and I remember, doing this when I was 2008, I was a revenue forecaster in the state of New Mexico. And I still remember doing a revenue forecast, in July of 2008, when oil was I remember the day, oil hit $142 a barrel. And we thought we would be cautious and just assume that oil was going to stay at $142 a barrel forever, right? Just for the next year. And that morning, I think Goldman Sachs or one of the banks came out and said, you know, oil's going to hit $200 by the end of the year and everything's going to go crazy. And I can remember sitting in an executive session with legislative leadership getting yelled at, quite frankly, because they thought we were being too cautious. You'll notice if you just pause right there and think about the timing of that. So that's in July of 2008. Does anybody know when the Great Recession technically started? It started in December of 2007. So we were already 7 or 8 months into a recession and didn't realize it yet because we were looking at tax revenues, right? Does anybody know who would or should have known about the recession, you know, way sooner than we ever knew as revenue forecasters? It was the state Medicaid director, right? Because if you go back and you look at Medicaid spending at the state level in 2008, in the first quarter, you see a huge 25% spike in the first quarter of 2008, right? And that's not something that we paid attention to, and it's not something that we knew about as revenue forecasters. It's one of those things where the right hand doesn't know what the left hand is doing. But it was very clear, looking back at the evidence, that we should have known in the first quarter of 2008 that something was coming and something bad was going to happen with our budgets. But you still had most of the states, and I'm picking on New Mexico because I was there, but most states didn't realize that there was going to be a problem with their revenues until at least September or October of 2008 when Lehman Brothers went under and the stock market, you know, went on the fritz. So looking at the whole picture of your budget, not just the revenue side, but also the spending side, especially those mandatory social services items like unemployment insurance, like Medicaid, that can really be the canary in the coal mine to help you better understand what's coming down the pike. And again, help you to be proactive as you're making what are going to be some very, very difficult fiscal decisions going forward. So now that I, again, thoroughly have bummed you all out, I would be happy to answer any questions, Neil, if anybody has some. I think I see some come through on the chat function there.
Here we go. Thanks. Thanks, Dan. We'll now open the floor to questions. And as I said before, please write in the Q&A box. The tab can be found on the bottom of your screen. One of the questions that has come in through email, Dylan, you mentioned the importance on contact tracing. There was an article in today's New York Times about the epidemic splintering into so many outbreaks that dealing with them is going to take different solutions. But in the article, the author makes the point that there are so many cases now that contact tracing is now moot. And as many states are spending funds, particularly in their CARES Act funding, to do contact tracing, should they continue spending that money, or does the number of cases make it moot?
Yeah, that's a great question. You know, I think one of the things that is really important is that, unfortunately, no one public health intervention by itself will be enough to really get us to the point where people are going to feel comfortable to spend and to go out into the community and to be engaged economically as we were prior to COVID-19. We need to use multiple interventions. Hand washing, testing, tracing, isolation, supporting. But this article was a really good one from the standpoint of when there are so many cases that contact tracers can't keep up, that is one of those public health vital signs that tells us we can't, it's beyond our control at this point. We need to think about other sorts of measures to really bring it back into control. And so that's actually really good information to the public health folks to move that forward. But it unfortunately would be slightly short-sighted to, if once we've gone past the peak where contact tracing isn't as effective as it would be when you have fewer cases, you're going to be coming back on the downside where it will be more effective eventually. And so being able to find the strategies that you can actually keep those people on staff and being able to useful in some capacity is going to be really critical. The other thing I would point out with contact tracing is we need to think more strategically about technology that would be force multipliers for our army of contact tracers so that we don't need as big of an army to go forward. There's some technologies out there right now, but still they need to be, they're promising but unproven, and we need to figure that out very, very, very quickly.
Thank you. A question for Dan. This comes from Representative Susan Almy from New Hampshire. New Hampshire looks fortunate, but 64% of our public revenues comes from and stays in municipalities and counties, which are fueled by property taxes and pay for what we should be statewide services. Does that make a difference to your chart of size of impact?
That's a great question. No. So the data that we use for our stress tests actually comes from the National Association of State Budget Officers, and it's the data that comes from the states themselves. So that is reflected in those numbers. One of the things that we see, and I saw a comment about Idaho previously as well, one of the things that may be skewing those maps in terms of what you're expecting to see versus what you're seeing is the size of the public sector in those states relative to overall GDP. So the public sector makes up a large portion of GDP in that. If we were to look at it as a share of budget, overall budget or something like that, the impacts would seem less. The point I'm trying to make with these charts, though, is that if states are required to make those fixes on their own, so they get no help from the federal government, they've got to do this through raising revenues or cutting spending, then the economic consequences of that are pretty significant, especially in smaller states where maybe government takes up a much greater importance in terms of overall GDP.
And we have a question from Assemblyman Felix Ortiz, the assistant speaker in the New York Assembly. How, in this period of, where the states are under duress, how can states raise revenue? What should they be doing to close their budget gap? Any advice?
Well, I think it's all about timing, right? So, 2020 is over. And so, most of that's going to have to be done with, accounting tricks and things that we can do, whatever we can, fund balances that we can throw into different things. Fiscal 2021 is unique in that it is, especially under that more severe scenario that we talked about, best case, the economy is very fragile right now and in the very early stages of recovery. Hopefully we're not headed into that double dip recession, but to impose tax increases at a time like that, it can be very damaging to the early part of the recovery. And so what we've seen in previous recessions is, spending cuts work best early on when we're kind of coming out of that recovery. But as we get into fiscal 2022, that's when it's usually a little bit easier and a little bit more effective from a fiscal policy perspective and an economic perspective to look at revenues as opposed to spending. So I would imagine that the majority of cuts for fiscal 2021 are going to come on the spending side. And we're going to balance things either through reserve balances and spending cuts and maybe some small revenues around the edges. But the majority of it will be on the other side of the ledger. When we get into fiscal 2022, and you as policymakers have had a bit more time to kind of gauge the economic goings on in your state, you have a better sense of who's being affected and why. It'll make it a lot easier to kind of tailor revenue increases in a way that is least disruptive economically at that point.
Okay. Another question has come in. Is there anything, Dan, you would suggest for state governments to do that can make the first or the least severe scenario more likely?
Well, it's an interesting tightrope to watch, and I'm sure I see Dylan's already over there smirking because he's having to do it all the time. It's the cross between keeping that keeping the outbreaks to a minimum, and especially the strain on your healthcare system, but at the same time making sure that people can get around and do everyday economic activity. In a way that's safe, because we don't need to shut everything down and everybody stay home. There are safe ways to go about doing those things, but making sure that commerce has the ability to continue on in a safe way is absolutely crucial. And so if we get really draconian about this and we say, okay, everybody stay home again, that's when you see that double dip recession. That's when things go off the rails. But if we can get everybody out in a safe manner and really continue the economy growing so that we can limit the unemployment insurance, we can limit all those other things, that's where we start to see that baseline really come into play more often. And the other thing that we can do is to call your congressman and tell them to make sure that there's some state and local aid in that bill. That's a lot easier to get through as well.
Yeah, the only thing I would add on to that is that excellent explanation is that, there is a false dichotomy between public health and the economy. We need public health for people to feel comfortable interacting in the community. We need a strong economy for people to keep healthy, without a doubt. We need both.
Following up on this discussion, as we entered into June and July, or actually when Memorial Day, when some of the states started to open up, particularly in the southern areas, and now we've seen a sharp spike in the cases in those states. Governors now beginning to close back some of the restaurants, bars, doing some other actions. What can states do, in a sense, to prevent those kind of spikes? I mean, is it masks and social distancing enough, or are there other things states should be considering?
Well, I think that there's a handful. It depends on the location, but it's definitely true that we're seeing new cases increasing in places like Mississippi, Tennessee, Nevada, Georgia, Oklahoma, in a range of places. And what we're seeing in the trends in the data now is that it's largely the younger individuals that are. Previously, we were seeing the cases in older individuals in congregate settings like meatpacking plants and nursing homes and in the prisons. Now we're definitely seeing it in the younger generation, from 15 to 30-year-olds, is where we're seeing a lot of the cases. So unfortunately, it's a little bit harder to orchestrate the policies to try to stem the cases in those particular cases. But definitely bars, definitely places where people are coming together unmasked and in close proximity. And so bars and restaurants are places that need to be thought through very carefully in terms of how to allow people to engage with those but be very safe. Personally, I think that bars are going to be very challenging if you want to try to control outbreaks in particular places, as we've seen from some of those southern states.
And another question states are dealing with now, and school districts as well, is whether schools should be opening for in-person classes or a mixture, hybrid of both, in-person and virtual education. And don't want to put either one of you on a tough spot here, but can schools reopen now, in-person classes, or we're still not there yet?
Yeah, I think it depends on the location. And so in places like Maine, New York, in Hawaii, there's definitely some localities that you see the outbreak in a little bit more controlled space. But if you have if you're able to actually control the spread in the community, likely being able to open for in-person classes in schools is going to be much easier. If you see in places where it's the virus is spreading broadly in the community, it's going to be much more challenging to open schools and not control the virus spread in those communities. And that's the unfortunate reality of it.
I'm obviously not the expert in that. I'll leave that all to Dylan. But the one thing I will add to that is that the decisions of whether or not to open schools and open daycares in particular is extremely important for some of those economic forecasts that I talked about, because there are so many people who maybe don't have the ability to work from home, like so many of us are blessed to do. And without childcare, it's really going to put them between a rock and a hard place. And there are major employment outcomes that happen if we don't have a way that the schools can open up, very soon. Okay, that's all the questions we have. Anyone else last minute want to write in a question? From Susan Almy, Representative Almy in New Hampshire, for Dan, thank you. I'll talk more with the heads of our budget office, but we do track county and local spending much, and only a year later in New Hampshire. Not really a question, but thanking you for your response. Yeah, I'll be sure to keep an eye on that with New Hampshire as well when we look at that data that comes over from our friends at NASBO. Thank you, gentlemen. I appreciate your time.